Hi, my name is Laura Nickrent, and this is my demonstration speech for Communication114. As a quality improvement specialist, I am focused on patient outcomes, improving them, and also decreasing healthcare costs. I will be demonstrating the monofilament test. The monofilament test is used to screen for diabetic peripheral neuropathy. The CDC has given us a number that diabetes has tripled since 1990. In addition to that, the Agency for Healthcare Research and Quality has given us a number of $174 billion that's used yearly spent on diabetes. The majority of that money is spent on foot ulcers, foot amputations, etc. Let's talk about diabetes for a minute. Diabetes is the body's inability to make or utilize insulin. Insulin is required to metabolize carbohydrates, fats, and proteins. With prolonged high blood sugars, the body can suffer from vascular complications of the eyes, kidneys, and heart. When the vascular complications affect the nervous systems of the feet, that's called diabetic peripheral neuropathy. That is significant because a patient can have foot injury, tissue damage without even knowing it. The American Diabetes Association recommends a comprehensive foot exam yearly. In addition to this exam, they also require a monofilament test. The monofilament test is within the scope of nursing, however, the majority of us do not know how to do it or perform it. So I'm going to go ahead and get started demonstrating how to perform a monofilament test. I'm going to use a member of the audience as a patient. So that member will come up now to the chair. In the clinical setting, you would have your patient have the shoes and socks removed. This is an excellent opportunity to educate and discuss daily foot care. The monofilament tool, if you can see this, is very simple to use and inexpensive. It's actually just a little cardboard with a 10-grain wire attached. Okay, put your foot up here. You will demonstrate to the patient that the wire is not sharp, and also you will let them know that you'll let them know that the wire is not sharp, reassure them, and you will let them know that this is a point of reference of what they'll be feeling. So you'll take the wire, hold it perpendicular to their toe, and when they feel a positive response, they'll raise their hand or say yes. Okay? And then you will continue on at the first metatarsal. You'll say yes if you feel that. You'll say yes.
Yes.
And you'll continue on also. On the dorsal side of the foot, you will go between the first and the second toe. Remember, you will hold it perpendicular to the skin for 1 second.
Yes.
Okay? All right. So this patient had a good sensation in his lower extremities, his feet. A negative response, or the patient does not have any sensation in their feet, puts him at high risk for foot ulcers. As diabetes continues to increase, it is imperative that we continue to screen for diabetic peripheral neuropathy. As nurses, it is our responsibility to improve patient outcomes and decrease healthcare costs. In accordance with Healthy People 2020, they have a national goal to decrease foot ulcers and amputations. We must continue to strive towards that also. That concludes my demonstration speech on the monofilament test. I hope you found this information informative, educational, and you can use it in your clinical setting. Thank you.